Keto diet has become a very popular and trendy diet online in recent days, and it has been praised for weight loss, controlling diabetes, and surprisingly, some even believe that it fights back cancer as well. But the question is, does a keto diet make you live longer? Or is this diet killing you faster by generating hidden health risks? As the name suggests, the keto diet is a very low carbohydrate diet that puts the body into a state of ketosis. According to Dr. Francine Blinton, who is a professional nutritionist and public health expert, keto diets should only be taken under medical supervision and for short periods of time. In combination with chemotherapy, they have been able to shrink tumors and decrease seizures in epileptics. Experts in the field caution against it, citing unpleasant side effects, health concerns, and the diet's inherently unstable nature. Even many proponents of the ketogenic diet agree that if the diet isn't done the correct way, it might have the opposite effect of healthy eating. So, takeaways from several studies we will discuss following long-term health concerns you should know before following keto diet as a weight loss strategy. A normal carbohydrate consumption on the keto diet is less than 50 grams per day, which can be a shock to the body. The flu-like symptoms may occur when your body depletes its carbohydrate reserves and transitions to utilize ketones and fat as fuel during the beginning of this eating pattern. Also, dehydration and electrolyte imbalances occur when your body adjusts to ketosis and can cause headaches, dizziness, tiredness, nausea, and constipation. Ketogenic dieters eat animal products high in fat since they don't contain carbohydrates. The danger of kidney stones increase if you eat a lot of these items. Your blood and urine can become more acidic if you consume a lot of animal products. This leads to greater calcium loss through urine. Also, if you are a CKD patient, your kidneys may not be able to eliminate the acid accumulation in your blood that occurs from eating animal products. A condition of acidosis might result, which can exacerbate the course of chronic kidney disease. This is because the keto diet limits numerous items, including nutrient-dense fruits and entire grains. Keto diets may not supply adequate calcium, vitamin D, magnesium, and phosphorus, according to certain research, which eventually makes you nutrient deficient. In a study of 11 people with type 1 diabetes who maintained a ketogenic diet for almost 2 years, the median number of low blood sugar episodes per day was close to 1. Low blood sugar is a common occurrence for individuals with type 1 diabetes who are taking too much insulin and not ingesting enough carbohydrate. In other words, a low carbohydrate ketogenic diet may raise the risk of heart disease. Diabetics type 2 patients who are on insulin may theoretically experience the same thing. The ketogenic diet has been associated with lower bone strength in several animal studies. This is likely due to a drop in bone mineral density that occurs when your body adjusts to ketosis. 29 children with epilepsy were put on the ketogenic diet for 6 months, and 68% of them had decreased bone mineral density scores following the diet. It's not recommended to follow the keto diet long-term because it's so restrictive. After 30 to 90 days, Josh Axe, a doctor of natural medicine and clinical nutritionist, recommends a more sustainable eating regimen. Christian Kaiser, RD, a nutritionist at Houston Methodist Medical Center.
Again, you can follow any particular diet for a short period of time and it will typically help you lose weight, but they're not sustainable. And a true lifestyle change is something that I have changed my lifestyle so that for the rest of my life.
As soon as they start eating carbohydrates again. Over 130,000 individuals participated in a long-term observational research, which associated animal-based low-carb diets with increased odds of death from heart disease, cancer, and all causes. On the other hand, a research of over 15,000 individuals showed similar results, except that both low and high-carb diets were associated with a higher mortality risk from all causes than were low and moderate carb diets, where carbohydrates represented 50 to 55% of total daily calories. So, should you avoid the keto diet? Keto diet may be helpful for some people, but for people such as pregnant or breastfeeding women, children and teens, or diseases like CKD, liver disease, or pancreatic conditions, for them it may not be appropriate unless it's being used therapeutically under medical supervision. Also, for diabetic patients, if you want to follow this diet without consulting a doctor, it is not the best idea to follow this diet. Make sure you have pleasure and fullness from the meals you're eating, and that you feel well and are receiving great nutrients from a range of foods. That will help you keep up and keep the weight off.
Thanks for watching our video. For more healthy experiences, subscribe to our channel and keep yourself updated by pressing the bell icon.